Welcome to Nouvelle Medical Spa. My name is Dr. Hanna. I'm the Medical Director, a board-certified cosmetic surgeon, and today we are here with Connor, and we're going to do a procedure called liposuction of the male breast, or a condition that we call it in our lingo gynecomastia. This is a condition where we have more fatty tissue than it is supposed to be in the male breast. And the liposuction, especially the liposuction using the ultrasound technology, we're going today to use the Vaser liposuction technique on Connor, and that is the ultimate or the beneficial treatment or the most successful treatment for the gynecomastia. So Connor here today, and we're going to proceed with tumescent anesthesia. Now he's awake. He had some light cocktail, so he still can hear us and can hear our conversation and respond to us. How are you doing, Connor?
Great.
Good, good. Did you have the cocktail?
I did.
How does it feel? Relaxed?
Relaxing.
Relaxed a little. Okay. So if you've never been to an operating room, or if you haven't been to a liposuction procedure, you can have an idea about what we usually do. There is a disclaimer that I have to tell you. We usually put the mask not this way. We put it on our nose and our mouth, but just for the sake of the video, the mask is being really kind of like dropped so we can actually talk to you today. The procedure is sterile, so after Connor has some pictures, we have made some drawing on the breast tissue, so we will know exactly what are the areas that really need to be attended most. And if you look around, you will see a monitor, so that we have Connor being monitored for all the vital signs that we really need to know. So we have the blood pressure evident, we have his pulse, I know what he's doing in terms of breathing and oxygen. So all these vital signs are being monitored all throughout the time that we are doing the procedure. Now a lot of people get scared about what is that Vaser or what is that ultrasound technology, and if we look around, there is an apparatus or a gadget down here by the end of Connor's feet that will give us the technology of the ultrasound. Now the ultrasound helps to what we call emulsify. Emulsify means, in a simple language, make the fatty tissue as a liquid form. The more liquid that we can get of the fat, the easier that we can actually take the fat out. So we're going to go through 3 steps. The first step is basically the anesthesia. We're going to use here tumescent anesthesia. Tumescent anesthesia is a cocktail of medication that will help to numb the tissue and makes the tissue not bleed and have the ability to have the liposuction with easier process rather than if we just have a general anesthesia. So the first step is anesthesia, and this is what we're going to do. We're just going to put a little needle here, and through that needle we have the cocktail of the medicine coming through that sterile tubing, and that will go through the skin and the fatty tissue, and it will make the breast completely numb. We're going to start with the right side, and then we're going to move on to the left side. And the surgeon usually have a remote control pedal where he can control the flow of the medication down. So right now we have a flow of local numbing medicine that is going into the tissue, into the skin and the fatty tissue surrounding the breast. And we're going to go through all the area that we want to do the liposuction on.